Hey everybody, do you have teenagers or young adults that play sports? Then this video is for you. Listen to the end because we're going to give you some information that's going to help you in case one of your children has this type of injury. Hi, I'm Dr. Nick Circolone. I am a chiropractic orthopedist in Chattanooga, Tennessee. And today we're going to be talking about stress fractures. Not just any stress fracture, but stress fractures associated with the pars in the lumbar vertebra. Now, how often this happens? It may be more common than you think. Most times, it's either misdiagnosed or treatment's delayed. We have young adults that are playing sports. They injure themselves, and we say, oh, they're going to be fine. They'll be better. Give them a couple of days. Give them a couple of weeks off. Or we turn around, we find out that there's a problem. We'll send them to physical therapy. We don't necessarily do an x-ray. A lot of times we do, but here's the thing. We will not see that stress fracture on an x-ray. So what we'll do is we'll say, we have a competitive athlete. They want to play sports. We got to get them back into the game. So we'll do some PT, send them right back into the game. And later on, the back pain gets worse. So if you have an athlete, and we're not talking about just elite athletes, we're talking about any teenager or young adult that plays a sport. It can be any sport. It doesn't have to be a major contact sport like football. It can be as simple as gymnastics or even cheerleading, which can cause some of these problems as well. So let's go through basically what happens. We have a student, teenager, young adult, playing sports, and all of a sudden, they start having back pain. First thing we do, we take them to the doctor, we find out what's going on. Sometimes we'll get an x-ray, sometimes we'll get medications for that, and we'll get them right back in the game because the pain goes away. Sometimes we have the athlete, no matter what they're doing, they have some sort of back pain or irritation. Let's say running causes more pain, so we stop running. But sitting down in a chair at school, sitting on the couch, they still have a low-grade back pain. When they go to play their sport, they feel fine. But after they're playing, they have problems with that low back pain. These are the types of things that we want to really get evaluated. If a young person has low back pain, that should be a red flag right away. Let's get this evaluated. And not just throw medications at it, not just throw PT at it, not throw manipulative therapy at it. We want to make sure that we pinpoint the exact cause of these pars defects or pars fractures. Most times what we'll see is older patients, they'll come in and they'll have what's known as a spondylolisthesis. What a spondylolisthesis is a fracture of both pars, and we have movement of that vertebral body. Sometimes we don't. So it's really important that if the first x-rays that you get taken, that they're not just straight on AP and lateral x-rays, which means they're in the front to the back and the side. You want to have flexion, extensions, and obliques. Obliques are very important because that's where we can find out if the pars has been fractured. A lot of times, that's all I order. I order flexion extension, lateral, AP, and obliques. If there is no fracture that I see on the patient, what we'll do is we'll conservatively treat them for several visits. Sometimes we'll keep them out of the game. Sometimes we'll modify the activity. If they don't respond within a relatively short period of time, then we're going to go to another step. Now, here's the thing. The biggest and best way to find these injuries is through examination. Not imaging, but examination. Because that's going to produce a treatment plan that's going to include the imaging that is necessary to see if we have this problem. So the first thing we do is we have the patient come in and we do orthopedic evaluation of it. We check their reflexes, we check their muscle strength, we check, see what's going to cause pain, what doesn't cause pain. If some of our exam causes pain, we're going right to get films. Sometimes the exam does not cause any pain. Does that mean that there's nothing there? Of course not. So then what we do is we find out what activities this patient does that increases their symptomatology. Good example of this. I have a patient who we are treating right now that has this similar problem. And I'm hopefully in the future, we're going to have him on to do an interview with me so that way we can see how they perceive what has happened to them. So the patient comes in, we're evaluating the patient. His orthopedic and neurological exams are normal. He's still having pain and he's had it for about a month. He's had it too long, so the first thing we do is we send him for some x-rays. We go get the x-rays come back, they're negative. We do light manipulative therapy, we do some muscle reconditioning, we do some stretching, the patient feels better. But if they sit in a chair too long, the pain is still there. Well, a red flag goes up when I hear that activity is making this worse. So our next step is we go and we order an MRI. We don't wait 6-7 weeks to order this MRI. We order this MRI right away. We get the MRI back, and lo and behold, what we find is modeling or a change in the vertebral body, the bone itself. So we see that there's edema in there. What's edema? Edema is not supposed to be in that vertebra. If that vertebra has edema, there is a problem. So what we do then is we kind of extrapolate from that this is a stress fracture. If you see edema in a bone, 9 times out of 10, it's a stress fracture, whether it be in the lumbar spine or anywhere else. So what do you do for a patient that is, and this one particularly is an elite athlete, they don't want to stop playing, because I guarantee you this patient would play ball regardless of his pain. He would work through that pain. That's how we could say dedicated to his sport. And if you have an athlete in your family that's dedicated to their sport, they are going to play regardless of their pain until they can't play anymore. Well, he was having problems. He told his father. The father brings him in. We did the exam. We did the x-rays. And then we do the MRI and we find the edema in the bone. So what happens at this point is I call a friend of mine. We send him over to see him. I knew it was a fracture. He knew it was a fracture. I told the patients, this is probably what's going to happen. The treatment for this is he's going to be off playing sports for 12 weeks. He has a special brace made with a bone stimulator in it to help increase the healing process. If you tell a patient who is an elite athlete, they are not going to want to do this. But I will tell you, if you don't have this taken care of at that moment, these stress fractures will produce a full-blown fracture, and that's going to be a problem for the rest of their lives. So if you have someone in your family who has an injury, the first thing you want to do is make sure you address that injury. Even if they make it seem non-threatening or they can work through it, they're okay, they will hide how they really feel because they want to play that sport. So the first thing you want to do is you want to take them and say, listen, we're not playing, we're going to get this evaluated, and you take them to your doctor. When you take them to your doctor, you want to ask that they take x-rays. Make sure those x-rays are not only AP and lateral x-rays, you want to make sure that they're AP, lateral, flexion extension, and obliques to evaluate that area. Number 3, if the patient doesn't respond to the conservative care in a relatively short time, and we're talking within a week to 10 days. If they don't respond, then you ask the doctor to order an MRI. A lot of doctors will kind of go, no, we don't need an MRI. There's not that much going on. We don't see a fracture. We don't see any problems. Let's wait on doing any kind of advanced imaging. I urge you to insist that you get that MRI, because if you find out that that patient or your athlete has a edema in his spine, that's a stress fracture. The next step is, once you find out that they have edema, some doctors are not sure what to do. Some doctors will send you to an orthopedist and they'll look at that and they'll decide on whether or not they're going to brace it and use a bone stimulator. My opinion, my beliefs, my recommendations are that if your athlete has a stress fracture, bone edema, that you get them the brace, you get the bone stimulator, and you make sure that they stay out of the game and heal up properly. Once they heal up properly, they'll be fine to play the game. Is it better to keep them out of the sport for a season, or to have them continue on and have a permanent injury? Of course, stop them from playing during the season so that way they can advance and play better in the future. These are not always cut and dry. Please don't think they are. But you have to be an advocate for your athlete, because sometimes in the system they get lost. So if you believe that your athlete has a problem that's not resolving, that low back pain seems unusual, make sure you get it evaluated. Make sure you go through the proper steps, that they get the proper treatment so they don't have a permanent injury later on in life. Guys, thank you for listening. We appreciate you all the time. We love you. Please subscribe, hit that notification button, and we'll see you soon.